It's not as if marginalized communities ever really get a break, including gender and sexual minorities, but this year continues to be an excruciating one, especially for the transgender, non-binary, and gender expansive community. While collective indulgence in outrage, like videos of people smashing or shooting their cases of Bud Light beer, are obviously ridiculous, they also send a clear message to us. It's not like Bud Light is suddenly a champion of trans people just because they work with a transgender influencer like Dylan Mulvaney. This was a marketing strategy, and so was the outrage. But all this outrage also tells me that not only do these Bud Light bashing folks hate me and oppose my well-being, they hate and oppose anyone that is friendly to me. They are so committed to erasing the existence of trans people that they can't even drink a beer that is guilty by association. This kind of outrage and the vigilance it requires on the part of every trans person trying to navigate the world with some measure of safety would be more than enough to deal with. But of course, there is and always is more. This last week, trans folks in Missouri have been living in the thick of the intentional, ongoing attacks against transgender lives. On Thursday, April 13th, 2023, Missouri's Attorney General Andrew Bailey issued expanded emergency regulations that effectively restrict and, in many cases, make impossible life-saving, life-giving care that many transgender and gender-expansive people depend on. It goes into effect April 27th and will be immediately confronted in the courts. The official justification for that emergency declaration from the AG's office calls it an effort to protect children. Quote, clarifying that because gender transition interventions are experimental and have significant side effects, state law already prohibits performing those procedures in the absence of substantial guardrails that ensure informed consent and adequate access to mental health care. Keep that reasoning in mind. It's experimental because it plays a key role in this particular strategy. It follows and uses the accusations that Jamie Reed made in February 2023 that a pediatric gender clinic in St. Louis associated with Washington University was permanently harming children by prescribing gender-affirming care like puberty blockers and cross-sex hormones. Whistleblowing is important, and transgender people do deserve the best care possible. However, that's not what's going on here. Importantly, Reed's testimony appears to be part of the problem, not the solution. Jess Jones, who worked with Reed at the center, shared, for example, that clients had raised red flags about Reed. Jones said, I really wish the center had listened to trans people who had reported problems with Jamie Reed. We said, this is a person who isn't safe for us. But Attorney General Bailey has doubled down, insisting in his proclamation that, quote, the regulation is necessary due to the skyrocketing number of gender transition interventions, despite rising concerns in the medical community that these interventions lack clinical evidence of safety or success. It's very cleverly done. And if you read the entire announcement on the AG website, you would never know that professional medical organizations have overwhelmingly published both policy statements supporting and standards outlining gender-affirming care, including the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, the Endocrine Society, the American Medical Association, the American Psychological Association, and the American Psychiatric Association. As I pointed out last month, and as Heather Borner wrote in Scientific American, all of those medical societies find such gender-affirming care to be evidence-based and medically necessary. That doesn't matter for our Attorney General. As such, he took another step this week in opening up a website for people to report medical providers directly to his office for providing gender-affirming care. And that's caused a lot of understandable fear and anger, leading to speculation that the state is creating a registry of transgender people. However, the website's purpose is most likely something else. It's most likely an attempt to locate people who can support the Attorney General's biases against transgender folks. In particular, they are looking for people who follow a detransition narrative like Chloe Cole and Luca Hine. We've already observed how anti-trans lawmakers have used Chloe and Luca's stories to silence all other trans voices and deny us both basic care and human rights. The Attorney General would likely employ a similar tactic in the upcoming legal defense of his emergency declaration. And that's most likely the goal for this website portal. They've gone fishing. They are fishing for people with stories that they can weaponize against the transgender community. So at least for now, the Attorney General is focusing on and asking for people to report on medical care providers. This does directly impact any trans or gender expansive person who's seeking medical care related to their gender identity or transition. But it does not mean, at least at this time, that the Attorney General is targeting trans people directly. At present, we're not at risk for being reported and or arrested for being trans, but we are at risk, serious risk, at losing our medical care and care providers. And that is key. The Attorney General is seeking to destabilize the trans community through robbing us of our medical care providers. And that's especially cruel for two reasons. These providers are often a backbone in our communities. We crowdsource trustworthy providers. We literally will make documents up of people that have provided good care to us or folks that we recommend avoiding. Those whom we trust with our care become a vital part of our networks and communities. We love them. We recommend them to each other. They are family to us. So in one stroke, the Attorney General is attempting to rob us of our medical, life-giving, and life-saving care and to cause division in our family, in our community. It puts medical providers in a difficult, almost impossible position of having to decide if they are going to risk the well-being of the transgender folks that are under their care by conforming to the emergency declaration, or if they're going to risk their own career and medical license by resisting the emergency declaration and continuing to provide the care that our community so desperately needs. That is purposeful and cruel to both our transgender community and our medical providers. We've been preparing for this attack for some time. From the very beginning of his time in office, Bailey has acted in ways that are aimed at harnessing outrage related to transgender people. Please keep in mind that this is a long-term strategy that doesn't even really rely on the success of his emergency declaration. It's meant to mobilize outrage at the expense of everyone who isn't cisgender. It's meant to enable bigotry, and it's meant to be able to use all those currents in order to empower his political ambition. This, of course, is part of a coordinated attack on trans lives, both in Missouri and around the nation. Powerful people are watching what is happening in states like Missouri to inform their own strategies against the transgender community. Please understand that these policies, emergency declarations, and legislation are being copied and pasted, and they're being adapted based on results that they see in other states by governments all across the U.S. This means that this moment is a very tender time for many transgender people, especially in places like Missouri. I've spent a lot of time during this last week providing pastoral care. There is so much desperation, with lots of understandable and practical fear and grief and rage. People are dealing with the shock at this moment, and it's so important that our community feels care and support right now to make it through this desperate situation. Suicidal ideation is high, along with the fear of losing medical care, confusion over what needs to be done, frantic contact with care providers, and scrambling even to locate to another, safer state. It's especially crucial that we survive these next weeks because the uncertainty is so high. And I'm reminded of Laverne Cox's words last January when she reflected on a bill that had just passed the Senate in Oklahoma that sought to outlaw gender-affirming care, and words that also apply to Missouri's situation right now. She said, "I'm exhausted, and trans people are exhausted. For years, we've been hearing from anti-trans pundits and politicians that this is about protecting the children, but I think what this Oklahoma law reveals is that it's never been about the children. It's always been about scapegoating trans people, stigmatizing us and criminalizing our existence, making us not exist. So please, remember all of us transgender and gender expansive folks living in places like Missouri, in your heart, in your words, in your actions. Being trans, well, being anything other than a white, straight, cisgender, temporarily able-bodied, financially stable Christian person in Missouri can be pretty tough. We have weathered worse than this attack, but we are tired. And this is going to be a tough journey to protect trans lives and transform hearts and minds. We've spent a week helping each other manage grief, rage, confusion, suicidal ideation. We've spent a week managing pop-up clinics to expedite care for people getting that care established before the new restrictions go into effect on April 27th, hopefully for only a tiny amount of time. We've spent a week helping each other pursue options for accessing care through mail-order prescription services and out-of-state clinics. We've spent a week helping each other explore options for moving to another state. We've spent a week communicating with our medical care providers and watching as that they have had to make decisions that weigh their careers with our care. We have spent one hell of a week. We're supporting each other, and we're doing an amazing job of it. We're not giving up or backing down, but we can use and we need all the community support we can get right now. Please don't stand idly by. Donate to organizations like the ACLU Missouri and Lambda Legal, who are spearheading the legal activities to oppose the Attorney General's emergency declaration and related legislation that's being considered. Donate to support organizations that provide much-needed medical care, mental health care, direct assistance, and social support. Volunteer at your local LGBTQIA+ center or clinic. Listen to trans voices and reach out to your transgender and gender expansive friends. Be there with them if they need to talk, if they don't need to talk and just need your company. And do your best to help them in whatever ways they request. Go to protests, go to lobby days, contact your political representatives, confront family, friends, and coworkers who are spreading lies and disinformation about transgender folks. Don't let them get away with saying that. Do whatever you are able to do. We need each other, both for our well-being now and for our future well-being. These are crucial moments when we decide what kind of community, nation, and world we are willing to live in. Please help us make it a world where everyone can be and feel safe, happy, and free. Thank you.